Hey, Dr. McNamara here, and today I have Alessandra with me, and what we're going to show you is how to use blood flow restriction training to help with symptoms of pain. And in particular, we're going to be talking about patellofemoral pain syndrome, also known as runner's knee. So Alessandra here is a marathon runner, and she's been training for the Chicago Marathon. She's getting really close to her race day. She's about ready to start tapering down, but she's been dealing with this aggravating, tedious knee pain that just doesn't seem to go away. We dove into the research a little bit, and we found some great evidence for how blood flow restriction training can actually help with symptoms associated with patellofemoral pain syndrome, aka runner's knee. Now, in the study that we found, what the researchers did was they took two groups of individuals, and one group performed your normal standardized type of leg extensions and leg presses, and the other group performed blood flow restriction training. For the standardized group, what they did was they did repetitions about 70% of their 1 rep max, while the blood flow restriction group did about 30% of their 1 rep max with the blood flow restriction cuffs on. And what they found in this study, which is super interesting and very exciting in terms of pain management, is that the blood flow restriction group had a 93% reduction in pain symptoms compared to the control group with the standardized training. So I'm going to show you guys how to apply the cuffs and then how you can do a single joint movement such as a leg extension, and then we're going to move on to a more compound movement, multi-joint planar movements to show you that as well. So to begin, we will get the cuffs on Alessandra. You ready?
I'm ready.
Okay, so first thing is you want to get the cuffs on to the limb, and you want the cuffs to be as proximal as possible, meaning as close to the body as possible. So we're going to go as high up as we can on the thigh, and then we're going to start strapping it in. And you want to make sure it's nice and snug, okay? So we're going to go around here and just make sure that's nice and tight there. Okay, perfect. Now, this is like a normal blood pressure type of cuff, but it's specifically made for blood flow restriction training. So I'm going to now apply the pressure. So you're just going to tell me when it feels good for you, okay? When you're feeling like it's enough pressure. Okay, we went a little bit higher, and that's good there. Okay, so now she is, we got the pressure cuff nice and tight. Now we're going to add some resistance to her leg, and she's going to perform some leg extensions, and she's just going to tell us how she feels when she starts feeling it and how difficult it is. So let's chat there. Kick your leg off to the side a little bit. You want to turn your hips, and then all you're going to do is simple leg extensions, just like that. Good. How's that feel? You feel that muscle contracting?
Yeah,
so this is a great way to help isolate a muscle that's difficult for someone to contract. If you throw these cuffs on, it's a great way to build that mind-muscle connection and improve the contractility of that tissue. Is it starting to get fatigued?
Yeah, you can tell it's definitely more difficult this way.
Yeah, yes. So what you'll notice when you have the cuffs on is that you're going to fatigue a lot faster than if you weren't wearing the cuffs. And we barely even have some resistance on. We just have this simple little band here, and she can feel this type of exercise. Yeah. So now let's show you what a compound movement looks like. Okay, so we saw Alessandra perform that single joint isolation exercise for the quadriceps with just simple leg extensions. Now we're going to step it up a notch with a multi-joint movement, and we're going to do that in the form of pistol squats. So let me just demonstrate what you'll be doing first, Alessandra, and then I'm going to have her do it on both sides. Just a few repetitions on the side without the blood pressure cuffs, and then on the side with the blood pressure cuffs, and she'll tell us kind of the difference it feels. So what you're going to do is a pistol squat. So for the pistol squat, you're going to want to drop directly down onto your foot and ankle. The knee's going to go over the toe, and you're going to extend the opposite leg, and then you're just going to lift yourself up. Okay, make sense? Go ahead and give that a try. Okay, yes, she's doing it with the non-blood pressure cuff leg first, and that looked great. Form looked excellent. Just give us a few repetitions so you get a good feel on what it should feel like. The form looks great.
Good.
Now she's going to try it with the blood pressure cuff leg and see how it feels on that side. So it looked a little more difficult from what I'm seeing. Good. Your form looks good. It's just a little bit slower, more controlled, which is excellent. And then that's the third repetition. So how would you compare that side to side? How does it feel?
Yeah, it was really more difficult on this leg.
Mm-hmm. Did you feel a little bit more muscle activation on that leg as well?
Yeah, it felt like the muscle was like tighter.
Excellent. So this is a great type of exercise to really work on that neuromuscular control, that mind-muscle type of connection, and it's really, really effective in helping with symptoms of pain. So if you guys like this information, if you're suffering from any type of pain, check out our channel for more videos on how we can help with certain exercises and activities. And guys, if you like this information, please like and subscribe for more health and wellness. Thank you.